From the Health Science Desk of the Boston Globe, I'm Stephen Smith, and this is Be Well, Boston. We've all heard it, get your annual physical exam. But is it really necessary? Dr. Krishnamurthy of BU and Boston Medical Center is here to talk about a staple of medicine. So, do we really need a physical exam every year?
So it's very controversial, and there's been concerns about how much an actual scheduled physical exam really adds to the screening and finding problems that may exist. The real purpose of a physical exam or an annual evaluation is really to do screening, to look for problems that you may have, to look at your family history, identify future problems, to identify ways that you can encourage your health and promote a healthy lifestyle, to update your vaccinations, and then screen for conditions that you might otherwise not know about that in the future, again, could affect you.
So in an exam, what sorts of screening tests should we expect?
So a lot of it depends on your age. So again, most of the things that we screen for are, cancer screening, and again, in the appropriate age ranges, depending on what age and risk factors you have. The concern is that doctors are over-testing, and the less is actually more. The two most important things your doctor does when procedures or tests that your doctor does is check your height and weight and give you advice based on that, and two, check your blood pressure to look for high blood pressure and other conditions that may be associated.
So it's probably a good idea when you have this sort of exam to have a discussion about, Doc, do I really need to have this every year, every couple of years? It shouldn't just be a default that you come in every year, right?
Correct. I think the most important thing also as part of the physical or whatever you do annually or whatever interval that you do it is have that relationship with your clinician, with your doctor. That you have a relationship that if you have issues that you're concerned about, that you have that relationship, you can bring that stuff up, and vice versa, that your doctor can identify areas that you should think about, maybe changing your diet, adopting a healthy exercise program, things that you can do, behaviors you can do, look for smoking or alcohol use that might be problematic to help improve your behavior and improve your health.
Dr. Krishnamurthy, thanks. And for continuing health news, stay with boston.com/health and the Daily Dose blog at boston.com/dailydose.